Hello, 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 and welcome to Wellness Wednesday. This is Dr. Latoya Wells, Doctor of Nursing Practice, family nurse practitioner, and owner of Wells Legacy Health and Wellness, welcoming you to another episode of Wellness Wednesday. As you all know, there are many different health topics that we will be discussing in the month of April. Well, April is also Alcohol Awareness Month. So tonight we're going to be talking about alcohol, its impact on our health. Is alcohol good for us? We've heard, if you've been watching the news or reading any research studies or just, scrolling through social media, we may see these articles or, these ads that show one glass of red wine a night is good for your health. Then later, you may hear something different. But we're going to discuss some of the things. And I feel like it's very important that we talk about alcohol because there are many individuals who have serious conditions related to or caused by alcohol. And many times we can't see them. And so when we talk about stress, we talked about that earlier this month, stress relief. We talked about stress. Many individuals will use alcohol as a way to de-stress. And I'm not here to say you can't, right? Because I have drank wine to try and, calm down and just kind of chill out or what have you. However, when you get to a place where you're not able to control the amount of alcohol that you're drinking or the frequency at which you are drinking, then there's a bigger problem at hand. So when we talk about alcoholism is a actual medical condition, and it's called alcohol use disorder. And this is a medical condition characterized by the inability of that individual to stop or control alcohol use despite the negative outcomes of it. We're going to talk about the impact of alcohol on your body, the use of excess alcohol on one's body. You all know I say everything in moderation. So if you are someone who loves, or likes to drink socially or have a glass of wine or what have you, to each his own. I'm not here to beat anybody over the head or judge anybody about what they do in their personal time. I just want to highlight some of the important things that we should keep in mind. Alcohol use disorder is not about willpower. And when I was younger, even I'd say let's go back 5 or 6 years ago, I did not understand the impact of alcohol or substance abuse on individuals' willpower. Because for me, I thought, well, if they just wanted to quit, they would. And I didn't understand that. Well, they see what's causing, the trouble that it's causing. They see that it's breaking up their family. It's causing them issues in their social arenas. It's causing issues at work. Why not just stop? Well, it's not about willpower. These individuals have a chronic situation where the alcohol use has affected their brain and their behavior. And so they can't just quit. And so we're going to talk about that. So what are some of the signs of alcoholism? Craving or a strong desire to drink, inability to limit drinking, and continue use despite it causing problems in relationship, work, or their health. I can't tell you the number of patients that I've seen with liver cirrhosis or other health issues related to alcohol abuse. And I can remember when I was younger, I had a friend whose aunt was taking care of her, and she was an alcoholic. And just to see the impacts and the change in her from the time that I met this friend in school until we graduated, it was drastic. And working in hospice, having an opportunity to take care of patients at the end of life and seeing the death and dying process for individuals who were on hospice due to end-stage liver failure related to alcohol abuse. It was just very sad. So we're going to talk about that. So what are some of the risks and dangers of alcohol? There are so many dangers to alcohol. Individuals think that, oh, if I have one drink, I'm okay. I can just get out and go drive. It scares me. It's very nerve-wracking, let me put it like that, because we don't know what individuals are under the influence of when we're driving. So for me, I have a routine. It's something I do. Yeah, we just have to be careful. Recently, there was a story about a group of young women, three 20-year-old young women, 20-something young women, went out to wherever they were at. They were coming home. They did not make it home. And there was some video footage of them driving and going high speeds, and there was alcohol involved, and they did not make it home. But their story is not unique. It happens frequently. How many times have we seen innocent people killed or hurt really bad because of drunk drivers and the wrong way drivers who are impaired or under influence of alcohol and drugs and are going the wrong way on the street? We really have to be mindful of our actions and how they can affect someone else. One of my favorite sayings is every action, every decision that you have has every decision that you make has a consequence, and you better be ready for that consequence. And so, there was a situation that happened in our neighborhood recently that was linked to substance abuse, and it was just sad, very sad. So, short-term side effects is impaired in judgment. You're not able to think clearly. You're not able to make sound judgment calls when you are under the influence of alcohol. Risky behavior, drunk driving, unsafe sex. I can't tell you the number of young ladies that I have taken care of in my time as a nurse that has come to whatever healthcare facility that I was working at due to being raped and not knowing because they were under the influence of alcohol and or drugs. The number of unplanned pregnancies because your judgment is not there when you're drinking. And then also alcohol poisoning. I've seen that alcohol poisoning from too much alcohol and how the body deals with that. Some of the long-term damages that we see or dangers that we see from alcohol use is liver damage, cirrhosis, fatty liver, heart disease, certain cancers of the head and neck, the liver, and the breast are increased because of the use of alcohol. Mental health issues such as depression and anxiety. Alcohol is a depressant. And so if you have someone who is already depressed and they drink alcohol to, in a sense, help, it's actually making this situation worse. And then addiction. I'm not saying that you can't have alcohol. I'm not saying that at all. And anything that I say or recommend here during Wellness Wednesday, I want you to make sure you're having that conversation with your healthcare provider. If it's anything health and wellness related, I want you to take into consideration, is this something that will work for me? Is this something that I need to do? I know sometimes I may step on some toes and sorry, not sorry, but I want to make sure that we get this information out, that I get you the information that you need to be able to take care of yourself and that you're being careful. When it comes to the younger community, and I can tell you, we see alcohol use as early as elementary school. I can remember when I was in elementary and middle school, I had a friend whose dad was an alcoholic, and both her and her brother started drinking when we were in elementary school because they were drinking their dad's beer, or he would drink the beer and have them taste some of it. And so they just kind of got into the habit of drinking alcohol. And I don't know where they are today, but I know in middle school, it was causing some problems. So it could definitely affect brain development, especially for younger individuals and pregnant women. It could have an impact on that baby, which then increases the risk of miscarriage or fetal alcohol syndrome. Some of the other things that we're going to talk about is in terms of, are there any benefits? Well, are there any benefits to alcohol? I'm going to leave that with you, and I'm going to let you decide. Again, there are studies that show that the use of red wine, 1 glass of red wine, and we have to understand what a serving size of alcohol looks like because it's not filling the glass up to a rim. I went to a wine tasting, and we got some education on serving size of wine, and it was not what I thought it was. It was really fun to go through that wine tasting. I couldn't taste all of the wine because I'd probably be drunk. I'd probably be drunk by the time I sampled the second or third wine. I'm very lightweight when it comes to things, and so I don't want anything. I don't want to put anything or take anything that's going to alter who I am or my ability to respond and function. And so for me, I know my limitations, and that's one of the things. We have to know our limitations, right? We have to know our limitations. And when it comes to the younger population, peer pressure and social anxiety and all of those things that they're having to deal with right now further puts them at a higher risk for partaking in alcohol and drugs. And so as parents, as adults, those who have influence on their lives, we need to be in a position to where we can help them and provide them with a safe space. So some studies suggest that moderate alcohol, so 1 drink per day for women and 2 for men, may increase HDL, which is the good cholesterol, and has a possible heart benefit, especially red wine, due to a certain chemical within the red wine. However, the benefits are not guaranteed and can be achieved through other means, diet and exercise, right? So there is some studies out there that show 1 drink of red wine for women and 1 for men each day. 1 drink for women, 2 for men may be helpful with some health benefits and provide some health benefits. But again, there are other ways that we can do that. Some of the risks, so the risks definitely outweigh the benefits of it, right? Especially if there's a family history of alcoholism and other health conditions. So if you have a family history of alcoholism, there is a higher chance that you will also become addicted to alcohol. And so we have to be mindful and know our family history. Know what's in your family. Know what individuals have dealt with, what health conditions they've had. I know it can be a touchy subject, and in certain communities, we don't talk about certain things, but we have to ensure that everyone knows what's going on and what to look out for. Another thing is some other side effects and other impacts that alcohol can have on your body. When it comes to your brain, it slows down the communication pathways. You can't think as quick. You don't respond as quickly. It alters your mood. So if you're someone who is in, one of the examples that I have of this is I can remember in high school, I had this friend. She was very, 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 very shy and reserved. However, as we got older and, going to the clubs and all those things, and she would get alcohol, get a hold to some alcohol, she became a completely different person. And she began to self-medicate with alcohol in certain situations. Whenever it was a tough situation, something that caused her anxiety, she would drink alcohol to be able to get through whatever that was that she was participating in. And it also changes your coordination. So you ever seen the individuals where they're given the field sobriety test and they have you stand on one foot and count backwards and say the alphabet backwards and, touch the nose, hand to the nose, and with your eyes closed, standing on one finger, lifting up 2 toes. They do that because there's a way to determine if someone is under the influence of alcohol or drugs just by doing those different types of body movement to check coordination. The liver, your liver is in a sense like a sponge, but it also detoxes it. It gets rid of the waste within the body. And so the liver works hard to get rid of that. And long-term use, overuse of the liver, ridding all the toxins and alcohol and all the other things, it begins to develop scarring and it can fail. Just like with any other thing. If you have a piece of gym equipment, that's the one thing that I can think about, a mat, and you're working out on that mat, you're constantly working out and there's a lot of friction on that mat, then that mat begins to break down and you have to replace it. Well, you only get one liver, right? Unless you are fortunate and have to have a liver transplant and you're able to get, organ donation. However, we don't want to go there. We want to take care of the liver that we have. You need it to live. And I'll say that to individuals, you only have one liver, right? You need that to live. So it may not be coming from a good place. And it may not have come across as being very professional. Now that I think of it, but I was trying to get a message through. The heart, it can cause high blood pressure, it can increase the pressure within the blood vessels. It can cause arrhythmias or abnormal heartbeats, and it also puts individuals at a increased risk for stroke because of those abnormal or irregular heartbeats. When it comes to the pancreas, it produces toxic substances, which leads to pancreatitis. I can't tell you how many individuals I've seen in the hospital who have issues with alcohol and are admitted for pancreatitis. There is a young lady that I know is very young, very, very young. And unfortunately, she has alcohol use disorder. And when you listen to her story, she has some things that have happened to her. And one of the ways that I'm assuming, one of the ways that she uses to cope is to use alcohol. And it's impacting her health overall, not just her physical health, but also mental health. It can impact one's mental health, worsening anxiety, depression, sleep disorders. If you have somebody who has insomnia, alcohol is not going to help it. Well, with me, it'll put me out for like 5 days, but everybody's different, and alcohol's effect on an individual is different. And I've talked to people and they're like, oh, my tolerance to alcohol is really high. I can drink, all this and not be phased. Well, you may not be able to feel it, all the effects immediately, but down the road, there are going to be some impacts, and it's going to help. It's going to impact your health. So some of the warning signs of individuals who might need help when it comes to those who have alcohol use disorder: individuals who are drinking frequently to relax, to sleep, or to feel better. And I mentioned earlier, there's a screening that we do in your physical exam when we're going through all of the review system, and we're asking you the social questions: any alcohol, smoking, drug abuse, several other things. And if you mention yes to alcohol use, we're then going to ask you, how many drinks do you have per occasion? Meaning, on each time that you drink, how many drinks are you drinking in that one sitting? How often are you drinking? Is that once a week, every day, nearly every day of the week? And then we're going to ask some additional questions. Do others criticize you for your drinking? Do you find it hard to quit? Are you drinking first thing in the morning? So there's some additional questions that we will need to ask to get a better understanding of where you are when it comes to alcohol use. Hiding drinking or lying about how much you drink, neglecting responsibilities either at work, school, or at home, withdrawal symptoms such as shaking, sweating, nausea, vomiting. There could also be some diarrhea and things of that nature. And then failed attempts to cut back. So you're not able to cut back. And there are some individuals who are high functioning alcoholics. And it is real. It is someone who may seem on the outside that they're fine. You won't see any signs of alcoholism. However, if you take a close look, a sneak peek into that person's life, you will see that they are struggling with alcohol use. And, it hits home. It definitely does when you think about all the people that you have in your family and those whose lives have been impacted by alcohol use, and the impact that it's had on the family unit is just really sad. When is it time to seek help? When is it time for an individual with alcohol use or alcohol abuse? When is it time to seek help? When drinking causes physical or emotional harm. Anytime anything that you're putting in your body is causing harm, that's when you should be seeking help. It interferes with your daily life. You're not able to get up and go to work and do the things that you normally would do without having to drink alcohol, or without alcohol having a negative impact on it. And the people around you are concerned, and they're mentioning, you may want to cut back. I think you may have a problem with alcohol. And we can talk till we're blue in the face as healthcare providers. I can talk to someone who has alcohol use disorder a million times and tell them all of the things that I just shared on here about how alcohol impacts that individual's health. Until they're ready, they're not going to quit. And my prayer is that it's not too late when they try to quit, that the damage has not the damage that they're doing to their bodies is not too far gone. And then when individuals are trying to quit but they can't, they need to seek help. They need support. They need help. And one thing I've found is until that individual is ready to quit drinking, they're no matter what you do or try to do to help them, it's going to be infutile. It's not going to work until they're ready to quit. So when someone is going through the process of admitting, one, you have to admit that they have to admit that they have a problem. Once they admit that they have a problem and are ready to seek help, some of the treatment options include detoxing and inpatient programs, outpatient therapy. There's different support groups such as AA. And then there's another one called Smart Recovery, which I found to be very interesting for that. It's very specific and personalized to that individual. And then medication assisted treatment, where individuals who drink have, really severe cases of alcoholism may require medication to help them quit. And then counseling. So there's different type of counseling that can help, because many times individuals who have problems with alcohol and substance abuse, there's an underlying issue that they're either trying to medicate or dull or run away from, and they run to alcohol to help. And so we already know the impacts of alcohol on individuals and the family and the community. And so whatever we can do to help that individual get the help that they need and get the support they need, then we definitely can. And I want to go back. There's no recommended alcohol limits for adults in the United States, according to the dietary guidelines. However, there's no standard, right? But there is some research. Let me take that back. There is some research and some recommendation that no more than 2 standard drinks per day for men and no more than 1 for women. I mentioned that earlier, but I wanted to highlight that again because I get that question often. So how many drinks is too much, and what is a safe amount to drink? Well, I can't tell you. I can't tell you as an individual, as a healthcare provider, what's a safe amount to drink, because I'm going to say don't drink. But, to each his own. When it comes to standard sizes, and that's where when I did the wine tasting, it was eye-opening how much a standard size was. So 12 ounces of regular beer, which contains 5% alcohol, is a standard size. 5 ounces of wine, which contains 12% alcohol, is a standard size. And then 1.5 ounces of distilled spirit. So alcohol, like vodka, whiskey, rum, all of those things, 1.5 ounces is a standard size. So we want to keep that in mind. Some of the things that I want to highlight in saying that even though there are some recommended daily limits, right, for those individuals who choose to drink, know your family history and know that there are certain individuals who should not be drinking. And it's those under 21, but how many of us see individuals under 21 drinking? Also, individuals who are pregnant, taking medications that could interact with alcohol. And one of the reasons, I'm not let me put it like this. I'm known to want to have a glass of wine every now and then. I don't anymore because during the pandemic, with all the stress and all of that, I had a friend introduce me to pineapple sangria. It's a wine, pineapple sangria. And I'm just being very vulnerable and honest right now. And during the pandemic, I found myself drinking more than I usually would. And so I pulled all the way back. And so now I don't drink. If I do, it's very, 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 very rare. And it's a little bit of wine if I do. I have a cabinet full of wine. People tend to give me wine for gifts and things of that nature, and I just leave it up there for when we have guests or what have you that come over. But for me, I knew, like, hey, this is a problem, and I think that some individuals have the ability to say, this is a problem. And one of the analogies that I gave when I was talking to someone who has substance abuse is I love sweets. And I can feel like I'm almost addicted to a certain sweet. I remember when I when I was pregnant with my daughter, and after I had her, I was addicted to the raw cookie dough. And I would eat a whole tub of that cookie dough. And this may not be a good analogy at all, but you get the gist. I would eat an entire tube of that, whatever you call it, of that cookie dough each day, and sometimes two a day. And one day I said, you know what? This is not good. This is not good for me. And it's not good that I'm eating it this much. And I just stopped. Same thing with Raisinets. I went through a period where I wanted Raisinets every day, and I had to have a specific brand, and I needed to have it. And, I craved it every day. And then I just got to a point where I was like, okay, you know what? I just can't do this anymore. And I know what we've learned today is that alcohol use disorder is not about someone's will. For me, I can just will it and say, you know what, I don't want it anymore. And I don't eat it anymore. I don't, eat that food anymore. I don't do this thing anymore. But for those individuals who have alcohol use disorder, it is a problem, and it's not about their will. So individuals who are pregnant, taking medication, recovering from alcohol use disorder, or driving or operating heavy machinery should not be drinking. And again, I go back to this phrase, all things in moderation. I'm not saying that you can't have a glass of wine here or there, or, a rum and coke or whatever it is that floats your boat. I'm not saying that you can't have that, but if you are participating or partaking in alcohol, make sure you understand and you know the magnitude of the impact that it can have on your body. Some people drink each and every day, and they never have any issues. I can't tell you who and who won't be impacted by it, but what I can do is give you the information, give you the knowledge. That way you can make a knowledgeable decision based on your health and what your desires are. Make sure that if you are drinking, that you have a designated driver and that you aren't driving. And that if the designated driver is drinking, then you get a Lyft or Uber somewhere. Make sure that if you are someone who will participate or partake in alcohol, that you're in a safe place and that you're around individuals who are going to look out for you and who are going to make sure that you are okay. We see time and time again individuals going on trips and getting drunk and being taken advantage of and being killed and being lost and never to be found. So make sure that you are being safe. Make sure you're taking care of yourself, and make sure that you're arming yourself with knowledge that you need to make wise health decisions. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. Until next time, stay safe and be well. We'll talk to you later. Bye.